So I'm going to get started because I know we have a schedule to keep for 1, 2. People kind of come in too. Boom, grab a seat, grab some forms here. Make sure you sign in to keep track of you. They'll come on your door later on and knock and see if you like to talk or not. I don't know. We'll see. So knee pain and foot pain. Okay, so just to be simplistic, knees are here, feet are here, and what happens in between? Everything. Our feet are so important, especially I want to say after 40, a lot of us will experience some type of foot pain. Okay, that correlates with your knee also. So we want to make sure everything that we do, we kind of timeline it back to sometimes an injury or sometimes just wear and tear we talked about a second ago, so we know exactly what may have been the long-term effect of or long-term timeline of when that thing started. So I start with on top with all my patients too. What caused your pain? Was it an injury? Was it wear and tear? Was it your job occupation? Do you have to lift a lot of stuff at work? Do you bend a lot too? I had someone come in today. She was a catcher in high school and partly in college too. When you're a catcher, you're down to your knees every inning. So what was your injury point and how do you get that to go backwards on your recovery too? How long have you had it? Why is the time of having knee pain, having just knee pain, not even a knee injury, so important? Why do you think that is? Anything in your body, the length of your condition, will cause things to inflame, wear and tear, cause things not to work properly for 1, 2. So over time it can cause problems that may have been treatable with a short-term treatment plan or icing or maybe some medications, but over time there should be some in front there. There we go. Yeah. So come on, stay on top. You're good, you're good. At that point, can we make sure, I got to go on time today. I got things to do. I got people, I'm getting famous here, so I have a schedule to keep, you know? You'll get caught. We'll just get started. So if we wait to get treatment for knee pain or seek care, the problem is over time, that can take longer and longer as we wait. Us guys, we're the worst. We're Neanderthals. We wait till we can't even get out of bed. Okay, now I'll get care. Most women think, I'm having a little bit of pain, get to a doctor right away. Guys are like, we're just going to tough it through until we can't tough it through anymore. So being smart about it allows you a faster treatment plan and hopefully a full recovery. Last part is getting started with understanding your knee pain. What level of pain do you have? This level of pain is important to me, and we're going to walk through in here too what that should be. At that point, I'm going to talk different levels of pain in your worksheet because that'll tell you when should you stretch, when should you ice, when should you start strength training your knee too. So knee recovery is important to understand where are you starting point. What I call acute pain is where when you go to get out of, say, knee or foot pain, you get out of a chair I just don't want to get out of a chair. It's hard to. I have to do this just to get myself out of the chair. I need help or someone to help me. So when you have the type of knee pain, you have to be very careful not to overdo it. That knee might have a small tear. Let's do this. I'm going to move you over just a little bit for them, if that's okay. Mm-hmm. Yes. A little bit here, because they need that seat too. You want to come over here on this side? Oh, yeah. You just give me 1 second here. I'll move this one out of the way too, because she'll be able to use her own chair too. Is that okay? Yes. Good? Okay. Perfect. Here's good. Okay, yeah, that works okay? Okay. We'll do a seat rearrangement in a second. Make sure we're all set. Musical chairs. How are you? Good. Don't take mine. That's mine. I need that. Over there.
I wanted that one.
This is my favorite one. Oh, take mine. I gotta know what I'm talking about, you know? Yes, that's okay. No, I don't. Not this is my famous one. Yeah. Pick a spot, any spot. Be helpful, people, like you guys are. Okay. Make sure we're all seated. All right. Musical chairs today. Let's give it a second. We'll settle in. That was my fault. I started too early, probably. so we'll see. It's got to take time. Again, we have to stay mobile, stay independent as much as we can. Okay.
And that's the same as about arthritis?
Yes, exactly.
Why you're telling me the
Good.
same as
So with knee arthritis or foot arthritis or even back or whatever it might be, it's a lack of motion that makes the ligament and the bone put down more calcium, more bone. So on an x-ray, you might see arthritis on the x-ray where there's more like bone spurs popping out. It doesn't look normal. You know, what can happen with arthritis too is actually look like more, it can cause inflammation and pain, which is actually an early sign of more bone arthritis, permanent arthritis. So you want to make sure you catch early enough, listen to your body, right? If I have pain, it's not going away, what am I doing? When I tell my patient, I joke with them sometimes, actually coming back to my office the second or third time, I go, you've had this pain for 3 weeks now. What do you think is going to happen? It's going to get better on its own? You're being optimistic? It helps a little bit, but over a period of maybe 3 or 4 days, it's not getting better. Get some type of care. Start something.
You know, doctor, when I go to the store, you know, and I find out when I get in heavy pain,
Yep.
I feel right away, my knees right away pulling it. Now, you know, I have something to pull, you know, when I go to the store, nothing getting it like this because I like to get to the house when my pain is so
Well, the
bad.
thing is, if someone has that in one of my patients, I want to go, how do we make the knees stronger? So you're, if anything, you're right here, over here. I saved you seat over here on this side. What happens, you're more in the level of pain, you're more in recovery. That's not a problem, not a problem. That's okay. That's okay. So what happens is when you're in recovery, it's building strength. You have to build strength in your knees. So I'm going to give you things to do today to make your knees stronger. Okay? But you can be in more of an acute pain we talked about a second ago, where someone has severe pain, they can't really get out of a chair on their own, get out of bed, need help, use a cane.
I'm not dead. I'm not dead.
No. But someone might be there where they need a cane or a walker all the time. Okay? So that might be acute pain where you want to do the therapies. But also moderate pain is where you're in recovery. It's sore sometimes, but it's not all the time. You're in more recovery where we have to get stronger. That's the plan.
And you know, when I feel with my knee, when I have to have this right shoes.
Uh-huh.
Because sometimes I have those shoes that are a little loose, you know?
Yeah, unstable. So we're going to talk about footwear too in a minute also with the foot care. Okay? So here, we talk about in your middle part here, the second paragraph, you want to call it that, treatment exercise based on your level of pain. Let's start with the knee. Okay, so the knee, if it's acute pain, acute means what? For me, it means it's going to be tender. I push on the bone, on the knee, on the joint, it's tender.
That's the acute.
That's the acute. If I move my knee, it hurts.
Yeah.
If I have someone else move my knee, it hurts a lot. What I mean by that's going to make you want to guard and tighten, you can't relax. It feels almost, when you get up, and even if you can get up, you try to take a step, at that point it's unstable. You always want to grab something in your mind because it might go out on you. So you want to make sure if that's acute pain, how do we treat that? Okay?
When you say you have acute, and then you have ice, what does that mean?
So ice means you want to put ice on the knee, but not just on the knee on the top, but also underneath, so you want to do both. Ice top and bottom, both. Because
Does ice bag work?
you can, but I just recommend just an ice compress, just a smooth ice pack, where you put on top and bottom, and sit there to where the knee goes numb. Not cold, it's numb. You want to push out the inflammation to allow new blood flow. Ice is good for circulation. So once you push out the blood with the ice pack, if you have acute knee pain, then what happens, your body naturally wants to cause new blood to the area. What does new blood have? Nutrients, minerals, vitamins, oxygen. Okay, the good stuff for repair. So you want to use ice in acute care to make that knee swelling calm down, where it's not tender, but also new circulation to allow the area to repair itself naturally.
And how long I can keep it down?
15 minutes. Or enough to where it goes numb. Once it goes numb where you can't touch it, it goes, hey, there's nothing there anymore, you're done. You want to do it long enough. It's not about making the skin cold, it's making the joint inside cold to push out the inflammation. It's a closed joint, so it needs that manual compression to cause that effect to happen. So it goes back through your veins and back to your heart to use that blood through your venous system. All right. I sound good, right? As long as I sound confident, you guys are going to buy what I'm going to say, so we're good. Now, but this is what I do with my patients all the time long. I want people mobile. I need people strong and mobile. So wherever they are, we work with them in my office to get to the next level, next level, next level. Second part is the moderate pain, right? Moderate knee pain requires now non-weight bearing strength exercises, okay? This is my famous one. I trademarked, I should sell this one, I think. Okay. So here, what I'm gonna do is show you, I'll do it over there too, is I want someone to dangle their legs. If I have a right knee, let's do left knee pain. Left knee pain, I wanna see, can they do this, extend their knee out, point their toe without pain? Or is it uncomfortable? Why is being uncomfortable okay when you talk about exercising? Uncomfortable is causing a stretch, and sometimes you need that to make the ligaments and muscles stretch more and move things around. If someone's had knee pain for a while, they can't get out of a chair, they're acute pain, it gets very stiff and tight. So you want to make sure we get things to stretch and move in the right direction. So I'm going to do 3 different moves with this extension, knee extension. I'm going to come up, straight up, hold for a second, then come straight down. But I also want to make sure I work out the inside and the outside of the knee too, combination. So I want to point my toe out to work the inside opposite side. When I point my toe out, I'm making the muscles on the inside of the knee work harder. Toe out, yep, toe out. Bring that knee straight up, hold it for a second, feel the inside work more, and then bring that knee down. What causes a lot of knee pain is you have your quad muscle. Okay, they break down 3 muscles from your quad muscle. 3 muscles. The middle is the magnus, outside is lateralis, inside is your medialis. By having those muscles over time, wear and tear or bad posture, bad foot position, at that point it makes the inside weaker and the outside tighter and stronger. That's going to cause an imbalance, right? Okay? Inside gets weak, outside gets tight. So it pulls the kneecap outside more, causing that knee groove to start the wear and tear.
How many reps?
I like 5 to start, work up to 10. So if I'm doing the straight one first here, 10 reps or 5, then the outside, work the inside muscle by pointing the toe out, work the inside muscle, and then point the toe in to work the outside muscle also. So we're going to do 5 middle, 5 going outside to work the inside knee with the toe, and now point the toe inside to work the outside knee completely.
And that, it has to be, when they have to sit in a high.
Yep, you want to hang your legs. So come on over. I'll show you.
Well, I would have bar chairs.
That's okay. But you can outside of the bed too.
You have to sit, I have
Yeah,
to
sit
sit
here,
down
yep,
here?
yep, yep.
Oh my God.
I know.
We should need hug.
All right, if not, we have,
I'm going to fail.
I'm pretty sure they have good insurance here, so you're covered.
Okay.
All right? So here, we're going to do now is I'm going to have you do is with this right leg
Okay.
is bring your toe straight up. Where do you feel the knee tighten up?
Oh, I feel very.
Right in the middle, right?
Yeah,
Perfect, strong,
yeah,
right? Good,
strong,
good.
yeah.
So now we're going to do is bring that foot down. And now bring that toe out. Out. We're going to bring it down first. Down. That toe out first. And now come straight up. Where do you feel it tighten?
In here.
Good. Inside knee
Yeah,
now. Inside knee,
inside,
right?
yeah,
Good.
yeah.
Bring the foot down now. All the way down. And now bring the foot in. And now bring it up. Where do you feel that?
Yeah, here.
Perfect.
I feel that pull.
Pull, right?
Yeah,
And it pulls from here all the way down.
Okay.
Good. This is the plan.
So I have to do it when both.
So for you, because you want to get stronger,
Yeah.
10
For how
10
long?
times.
Oh, 10
10,
times.
10 middle, 10 outside, and 10 inside. Both legs.
Wow, look at what I learned today.
Look at this. See? Yeah. All right.
I have
Make sure you
problems
pay on the way out, okay? Pay your fee. You got it. Grab a seat. Grab a seat. This is the plan. Well, the thing is, can we do things today? Can we do things today to make our body prevent having a bad injury? Who wants to fall here? Who likes falling? You like to fall? You don't. Yeah. But we don't want to fall though. No, we don't want to fall, right? Yeah. Yeah.
And but you know what? I think at that time I fell because not because I have problem with my feet, but because I want to look at where I
Ah. So you got to make sure.
to emergency.
Yeah.
So this finger
Yeah.
The other side. When I'm-
Yeah, anytime you fall, the problem, what we normally do, we do this.
So,
And hand, wrist, elbow, shoulder, everything.
and then, when the doctor made that question, are you afraid to fail? I said yes.
Yes, who isn't? Who's in the fall?
I think nobody
I love the fall all the time. No, I'm not a stunt double.
I'm not afraid
It's not what I do, right?
It's how you land.
Yeah, that's not the fall that hurts. The fall is fine. It's when that thing on the ground hits you.
But I fell both times
Yeah.
backwards like this.
Yeah, the hip.
How do you teach yourself not to do that?
First of all, don't play paddle tennis. Don't. She was playing tennis or the table tennis when she fell. You know?
The other time it was dancing.
Yeah, dancing too. Don't dance. Well, dance by yourself, like the ladies in the corner over here do. Not with someone else. That's a kind of chance of injury. Just saying. I try to pay attention. Try to keep the notes in my head. So, going back to this knee recovery. If your knee is in recovery where we feel pretty strong, but we want to stay strong, we have some instability, maybe a past injury, how do we keep our knees strong? Okay? I'll do this over in a second too. Recommend these. It's a wall squat. Okay? 2 ways to do it. I want to start it with just coming down on a wall, feet, and again, feet have to be pointing straight ahead, not out here, not inside, mostly coming outside for 1, 2. Want the feet straight ahead the whole time. Feet about maybe 1.5 feet off the wall, head against the wall, so we want to have good form the whole time. Coming down.
You're not straight right now.
Oh yeah, I'm straight now. Yeah, I'm straight. My body's straight, my legs are out front. So here, I'm front. I want my body here, put my hands on my thighs just for support. So if you can push up if you need to. I'm going to come down where I'm comfortable. At that point, I'm going to stay there for about, kidding. I just want to see your faces. I just want to hear the ooh. I just want to hear the ooh. That's all it was. So, go push harder. Go, hey, come and help me up. Come and help me up. So I'm going to come down where I'm comfortable. Try to keep your knees above your hips. So knees above your hips. Hold that position for about 10 seconds. Then if possible, don't use your hands and let your legs and your knees push you back up. No, you can. If you just go here and then push up. Using your quad muscles where's the quad muscle attached to? How does it work? Attaches your hip, but also attaches below your knee. By doing a wall squat allows your knee to get stronger. So I'm going to come here, again, come down where it feels a little uncomfortable, where that's going to be for you, and then let my quads push my body back and slide up against the wall. That's the plan. All right? Maybe 5 times to start, feels good, do 10 times. But again, the feet have to be straight. The body against the wall, looking straight ahead, not down here. Anytime we exercise, we want to exercise in good posture, we maintain this and relearn this, instead like I said jumping earlier, versus doing this. Here, more knee pain, more instability, weaker back. I feel I'm going to fall. Here, as you get stronger, at that point your body feels not only more confident, but then you use your brain to reset your balance, not you're looking down at the floor. All right? Questions about that one? So here, just to repeat one more time, sliding down where you're comfortable, hold for a second, come back. If you feel it's too far, use your hands to push yourself up if need be. Be your own best assistant the whole time. All right? Start with 5, go to 10, and then build on top of that. All right?
I wanted to say that it's interesting how you're teaching us how to walk.
Hmm?
It does make you stand taller. And in my image, in my mind, because I was associated with tennis players, professional athletes, and they all walk that way. They walk confidently, but they walk straight up. And it's that gait. And when I was trying to practice, I felt a little awkward.
Yes, of course.
But, it is noticeable. It's the way that they walk. And it's just a confidence, but they're skeletally. They're all in the right position.
If you look at a gymnast, the gymnast walks like how? They walk like this. Because they have to have good balance.
Yeah.
You know? Yes.
Walk like that.
And it's not the social norm because we're used to doing what all day?
Yeah.
All day long. So we want to make sure that we're learning and so again, if we want to set our posture too, correct? Good posture. again, this isn't on the form. We want to go against the wall, heels, hips, shoulder, and head. So we stay there 15, 20 seconds, heels, hips, shoulder, and head, and then take a step forward. Keep the weight on your heels so we walk more heel to toe instead of midfoot or toe to toe. I tell my patients, senior patients in my office, I don't want to hear your feet. I don't want to hear you stomping around. We have to walk, and we'll go over this at the very end too, how to walk properly to have good knee strength and also help your feet stay healthy too. That's a combination of both. All right? So now, a modified lunge here. I'll demonstrate on this side too. I want to do this one to where I'm going to use a chair for stability. I want to work, this works the knee with some of your body weight. This will work the knee, the modified lunge, with most of your body weight. So I'm going to come here, just to start this one first. I'm going to come here, hold the chair, body up the whole time. Take a step forward where you still feel stable. It might be just here. It might be further out if you're comfortable. Wherever it is for you, take a step forward, heel to toe, let your foot roll out. Keep the weight on your front knee, body up the whole time. Use the chair for balance. Come down where you're comfortable.
That would kill them.
Then come all the way up. If that's too much, again, hand on your thigh. Yeah, sure. No problem. I'll do a second. I'll do laser first.
Somebody to pick her up.
Exactly. Oh, one second. I'm going to come here, down, hold, then come back up. All right, so I'm going to do this. So what we'll do, here, we can do this so we can, right? Here, we come down, hold, and then come back up. We don't have to go too far down. So here, move this over here too. You can see it from that middle part. Here, also, I need to move the chair this side. Good, so here, a little bit, that's it. Here, right leg now. Forward, come down a little bit, hold, then come back up. Your quad muscle is used to help balance out your overall body. The problem is when we fall, we feel unstable, the outside muscles of your hip feel like they're weak. So when I come here, I want to make sure this muscle here, my quad muscle attaches below my knee, help my knee strength, but also my outside muscle, my TFL band, is also working to contract and make my body feel stable. So my knee just goes straight over my toes, not out here. Hold it. Contract that. Hold it for a second. Hold. Then come back up. All right, one more time. Other side. Here, contract your side muscle, some of your glute to your quad muscle. Come down slowly. Hold. Then push back up. All right. Any questions? What's that?
You're pushing with your knee?
Just with my knee pushing forward.
What's your back leg doing?
It's just relaxing back there. Just relaxing the back leg. I'm going to come back up. Just contract my quad muscle, my TFL band on the side, so I come straight back up and start over again. Maybe start with 2 on either side, then go up to 5. You can do it. All right. Next one. Any questions about those? I have a plethora of exercises, but we'll start with those 2 first. My biggest thing is not doing a lot of exercises. It's doing 1 or 2 that's comfortable for you, and then maintain those every day. I just talk all the time too. How many days what days of the week should you actually do exercises?
I do every day, almost every day.
Days that end with Y, right? The days that end with Y are days you exercises. You got it? Which is every day. Every day, find your routine. Everyone's different. Find your routine. Now your feet. Okay. If we have feet, everyone has feet, right? If we have feet here, okay. The biggest thing is taking a step becomes painful, right? When we have feet. Okay? So we want to make sure if we have acute pain in your feet, acute is going to be, again, swelling, tenderness, numbness. Sometimes it can be the bottom of the foot where you feel tenderness or tightness, but it can also be the inside of the ankle, but also outside ankle too, combination of both. So we want to make sure if we're going to get our feet to get better, we know where the injury point actually is. Right here. All right. take this one off too. I bought my slip-ons today. Woohoo! So here, we want to do is make sure if you have foot pain underneath your foot, exactly, you want to ice the area. Always start with ice. But with your feet, even with your knees too, try to elevate your feet above your heart. Why should you elevate your feet when you ice your feet? Why is that important? Circulation. Your feet are the bottom part of your body. Gravity pushes everything down to your feet. If you have your feet above your heart, it allows that venous system to push the inflammation out and swelling out of your leg faster back into your body. If you push it out faster, the opposite effect will get new circulation even faster too. So I have patients that I'll have them do exercises and then go ice in the back or ice at home with their feet elevated above their heart. Allow better circulation that way. Any questions about that?
I don't understand how you get to stare up there to be above your heart.
So you want to lie down,
Okay.
or you can do this and just hold your leg up. I'd recommend this kind of hard. I'd rather lie down. Just me.
Put them on a pillow or something.
Yeah, put them on a pillow. Put them on like on the edge of your couch for one, too. If you're on your couch, do that. Elevate. Find a way to elevate them. I like the bed too. A couple pillows on the bed. Headboard. Do that and see. Yes.
I have edema right now, and they recommended water pills. Why?
If there's edema caused by just water per se, pushes the water out. Water pills have see what is water? H2O, right? H positive, 2 negative for 1, 2. Allows potassium or allows. Let me a second. Hold on. I just saw this.
So when you're elevating it, how long do you hold it?
10 minutes.
10 minutes.
Just give you a time frame, 10 minutes. Because potassium is more for sodium reduction. So edema, give me 1 second, get my information right. Yeah, so what water pills will do is push out, using your body's chemistry, push out the water out of your legs, if that's what it is. That's what it is. Do you wear compression socks too?
Yes.
Good, perfect, yeah. At that point, swollen ankles, using water pills, if you have that type of edema in your legs, but for pain itself, the same thing will cause edema around the ankle or foot, even lower leg too. Always ice with elevation. Always ice with elevation, yes.
What about that, my son brought me this big pillow like it's slanted on the back
Yep.
and flat,
Oh yeah,
you know.
it's an edge pillow, yeah.
But I put my legs up on there and it hurts
Where does it hurt?
all the way through.
Your legs or your back?
My legs.
So it's almost, is it hurt when you're using the wedge?
Yes, yes.
Is it, so it does, okay, so it might be too much for you.
Very much because
No. It causes too much of a change in your legs, too much of a change in circulation. Your body doesn't like it.
oh, okay.
So maybe whatever you feel comfortable, stay below that tolerance of time.
Thank you.
Everyone's different, yep.
But is it also like extra stretch that the legs are not used to when you're up on one of those?
You should feel relaxed on that one. Those are meant for someone who has leg issues, even pregnant women too. They love those pillows. It's like a foam wedge that's about maybe this high.
But I use it for sitting in the bed to read.
Go for it. It's whatever you want to use it for. It's not North Korea or Russia. You can do whatever you want to do. As far as I know. Yes, it's whatever works for you. But at that point, I make my couch into a recliner. I don't sit on my couch, just make it a recliner. Because I'd rather relax on my couch or bed versus feel like I'm under stress. Yes. Yes.
The exercise on your knee, how often I can do it every day?
Every day. Every day it ends with Y, which is every day. So 5, 5, and 5. You got it. So now back to the foot, range of motion, okay? So by range of motion here, I'll do it up here. I want to do is take my foot and slowly push it this way. This is foot and ankle, right? Push it inside, push it up, and push it down. You always want to do at least 4 ranges of motion. So outside, inside, up, and down. If you want to be more aggressive with it, what you can do, where'd it go? Where'd I put it? Okay, here it is. Yep. So if my left leg is the injury point, I can do is take a band, even a bungee cord or a belt, put it on my feet, and slowly stretch my left side by pushing my right side away from the area. Here, bringing this up, even down too. Pull it down a little bit, even outside too. So how do you stretch your feet more by causing different ranges of motion? That's the plan. That's you're going to stretch it if it's not causing you to guard or tight when you do that stretch.
Is it the same exercise for people who work and stand them all day?
It can be because that's going to make the feet real sore. Again, we want to move our feet more. So if I have that type of pain too, what I want to do over time is slowly limit your weight bearing if possible. Again, if possible. If I have a job that requires me on my feet 8 hours a day, I got to work, right? But if I'm doing other things on my day, and if I have a foot problem, when I have a foot problem, should I wear shoes or not shoes? What do you think? When I have a foot problem, when I have foot pain on the bottom of my feet, should I wear shoes or not shoes? Shoes. Shoes give you more support. Shoes have an arch support naturally in the shoe that allows your arch of your foot here to stay strong. If you go, it becomes more stretched out, it starts to tear, causing pain. Plantar fasciitis. Yeah, bad.
You have arches in your shoe?
Yep.
I didn't know that.
I have arches all the time in my shoe.
I didn't know that.
I know, now you know. You know my secret. You know my secret now.
My sandals even.
Yeah, all of them, all of them. People that have foot problems, if you don't wear your arch supports, you're gonna have foot problems forever.
You know, I wear that support since the 2007.
Perfect.
Yeah, because I cannot walk at all sometimes. Sometimes I have to take my shoes off in the street
Yeah.
and walk without shoes.
Ah.
Because I was gonna handle the shoes anymore.
The thing is, we have to be careful with our feet, and you want to make sure when the shoes that you do have, just go. This is away from the topic here. Make sure your shoes are rigid. You don't want flexible shoes. I want to make sure the middle of my shoe, I cannot bend myself. I'm pretty strong, man. I take steroids. I'm pretty strong. I'm kidding about steroids. No. The ones that bend too easy have no support. So you want to have support for your arch here to make sure that's supported the whole time, right? Double, I don't know, grammar stuff.
Where did you buy that portable arch?
Amazon, $10.
How do you know which one is best for you?
For me, it's going to be the harder the better. So harder plastic. Yes.
What's the brand?
The brand is, it's called, let me see my Amazon here. Give me 1 second.
The Good Feet store will take impressions.
Yep.
Measure your feet. There's one over on Mills on the circle out by the 50.
Of course.
But you remember when CVS used to have the machine?
Yeah.
Where you, I actually bought some by the number,
Yeah.
and they really helped me.
It's starting something.
I was lucky that, they had it at the time, and it really worked for me.
Those are good. It's just, this is called QBK. Yeah. So it'd be, good.
Sorry,
That's good.
I'm in your way.
How do I? All right. So it'd be called QBK for, let's say let's call it orthotics or shoe inserts. Inserts.
They don't have that machine anymore, where you can
Or-
stand on it and it would tell you what number. They don't have it anymore. So now they have supports, but I mean, it's the same. Doctor, does it matter? Does everybody use the same one?
Nope, everyone's different, but let me pull some up real quick too. Make sure I get the right one for you guys. You want overall the harder ones are going to be better for you too. Let me see. Here's my second choice. Also, I give you two choices. Done. Search. Here we go. This is the one I like too. Or if you want the full support, what's this one called? If it's not just your arch, but your foot's sore in the front or the back too, you want the full arch support. Okay, this is a one I bought recently. Let me see if it comes up with a name.
Wouldn't our arches be different sizes for different people?
Not the back one shouldn't, but the short one should not be. But this one here, you can find them online. I don't have, there's not a brand name on this one, I think. Here. Yeah, this is just called, that's the half arch. For a full, I don't see this one. I don't have a name. There's one you can see it too. See, and you almost want one of these too, where they have the full support here.
Oh, yeah, I've seen them.
It's not. It's almost like the full gives you cushion for the front. The middle's going to be a hard surface in the middle, like hard plastic, just like that
That's
for the heel.
what it says right there.
Yeah.
Insoles, I think.
Yeah, it's more of a generic brand per se. That's the one you kind of want to see.
Everybody eat that at that one mark.
Yeah, you can buy it on the store or on Amazon. I'm an Amazon guy. I get boxes every day.
That new Amazon that says fresh, would they have?
Yeah, they're not. That's more of a grocery store.
Oh, okay.
Yeah. You could probably make something out of the food to an arch if you want. I don't know.
It's this one on the right?
That one, yeah. That's the top and bottom. It's just something like that. You guys seen it before too. The full orthotic for the shoe. Yeah, it just gives you the whole foot support. Sometimes what I'll do, I'll get them like because they offer different sizes. I get one size a little bit bigger so I can put it in on top of my insert in my shoe already. Take it out.
That's what I was gonna ask you.
Yeah.
If you're wearing tennis shoes and they support, they should have already support, do you also need the insole?
I would do just the arch support, just the half one, the one I have up here. That's what I would do. That's what I do for more of my shoes, just the half one. Yeah, yeah, good question. If you have good shoes already that have good support, at that point, just buy the half one. So all you need is the half one. But if you have shoes that don't have any support at all, at that point you want to make sure you have the full, maybe the full orthotic instead. My recommendation.
Yeah, mine said like yours, it's only half.
Yeah, that's those are easy to put in your shoe and out too. All right. So now, we talk about weight-bearing stresses for 1-2. We want to add in a tennis ball. Okay. You want to start doing things that make your foot more stretched out. Take a tennis ball, put it on underneath your foot, and just roll it on your foot. Just roll back and forth while you're watching your soap operas. All right? Or your dance shows. Yeah, good roll, yeah. But you want something small enough too. You want something small enough that actually goes on your whole foot. Because if it's too big, your foot won't want to move. You want your foot to move and stretch itself out. So you want to go, keep it real simple. Go front, go back all the way, hold for a second, go back and forth. Further out will be easier. Going toward below your knee will be harder. You can add more load to it. So add the pressure when you're comfortable, more pressure, if need be, to stretch your foot. All right? Simple stuff you can do. Because your feet, the problem with feet, we feel fine all day long. We go to bed, hurts the next day. Can we stretch throughout the day before we go to bed, especially so it stays stretched out? Because once you sleep, it'll naturally tighten itself up. Stretch before you go to bed or throughout the day so it stays loose the whole time. I tore my arch before, so I've had to go through my own personal treatment of getting my foot better. So I want to make sure you guys take care of your feet.
If you stay on them too long, I mean, like if you're on them,
And sometimes you have no choice. So taking your breaks whenever you can, taking the weight off your feet allows you to get that break a little bit. You know? Yes. Good. That's the next one. Okay, that's the next one. Go right now. You see, I missed anything else? Yeah, right here. So here. So we do this here. We're do this first. First, we're gonna do here is if you want your legs to recover properly, you can either use a wall or use a chair here too. You see this also. We want to do basically heel raises. Help your feet. Heel raises. Hold for a second, and then come down. Yeah, stretches. And your fascia goes from your heel all the way down to your foot. So you want to stretch everything up and then down. Okay, same thing here. If you can see it over here too. On that side, want to go up, hold for a second, come down. If you're comfortable, if it feels like it's easy, then go on one foot, Put more of your body weight on the one foot, and then come up, then come down.
See a curved area in the opposite, go down.
Yeah, you can do that also. Yeah, yeah. Whatever's going to stretch out that calf, you'll feel more in sometimes the calf muscle. But if your arch is sore, you're going to feel in your arch too. It's just stretching whenever you can because it's all connected. That's the plan, right? Now, the wall one. Okay, we know the foot one too. So here, if we have an injury in your feet or your knee or anywhere in your body, we normally then reset our posture to feel like we have to make sure we feel more stable. But the problem is now the injury's recovered. Now we're stuck in this position. How do we reverse that? So what we're going to do, go against the wall again, check your posture. Step one, weight against the wall, come all the way back. And then what I want to do is once we're there, let me turn this camera around to you for a second. You'll see it at home. Here, all the way back, and then make sure we're coming here. What we're going to start doing is state the weight on your heels. So when we're walking, we're going to start walking this way to where we walk heel to toe, rolling your feet. So to start this, if you're uncomfortable with this, start by using a chair. And just to get the rhythm down, here is you want to do is just roll your feet back and forth. Back and forth, roll your feet. Okay? It's like dancing, kind of. I don't know, maybe. Without shoes. Why without shoes? More, and your skin too wants to feel the difference. Roll your feet back and forth. Once that's comfortable for you, then go to the wall without looking at your feet. Here, I used to have a cameraman. You guys ever been a cameraman before? Ever been him before? A long time ago? He was blind, legally blind. Great cameraman. I have to go like, over here, Herman, over here. Great cameraman. I don't know why I got him. He was a great guy, though. Here, I'll go here first. I want to make sure I'm going to roll my feet, right? Get this chair out of the way so you can see it over there. I want to make sure I'm putting my feet, I'm going to bring my left foot forward on my heel, then bring my right heel up. You see that? I'm going to start over again. Left heel forward. Bring that left foot down as you bring your right foot up. We're trying to reset your walking pattern, your gait analysis. So I'm going to go one more time. Now my right foot, right heel forward, drop the right foot, bring the left heel up. All right, any questions about that? Barefoot. Come on over.
And then after,
Here, come on over, yep. I like doing things barefoot to start so you get the idea of what we're doing. Then the shoes, kind of numb out your feeling a little bit, right? So you want to do it without your feet. So shoes on are fine. Okay. So you've done this before too.
you want to see the holes in my socks?
It's up to you. Do you have pedicure? You have pedicure?
No, I have a toesies.
Very good. So here, good right there. So left foot forward. Drop the foot, bring up on the right toe. How's that feel?
Good.
Good. Other side. Right foot. Drop the foot. Left heel comes up. Good. Does it feel okay? Good. So now take a couple steps in that with doing that same thing. Holding on. How does that feel? Good.
I do that, but with tennis shoes when I'm walking.
Let's do it this way now.
Remember.
Wait, no, stop for a second. Now do it this way, but close your eyes. Mm-hmm. It feels weird, right?
Yeah.
So it makes your body, because right now when we use our eyes, when you use our eyes, we can figure out how to get our balance. When we close our eyes, at that point we go, okay, where did I go?
Yeah.
So having that change, now you're using your feet more to get your balance, not just your eyes. You're making you work harder, because the problem is when we walk, if we have to walk backwards, there's no eyes behind my head like my mom said she had all the time. Right? So we want to make sure we can walk forward eyes closed, heel to toe, whatever you want to do, but also walk backwards over time, using wall if need be, to get our body to reset.
But if we're a woman, we do have eyes.
If you're a woman, good for you.
Kids.
You are supernatural, whatever. We want to make sure we have ability, thank you. We have ability to get our body to retrain our balance point by slowly using a chair first, get your feet to roll back and forth, get that rhythm, and then on the wall, slowly, without your shoes on, one step at a time. And if you want to make it harder too, pause, and if you want to get harder, close your eyes, pause, and pause. So that once you put your shoes on, your brain knows to use your feet and lower leg to balance, not just your eyes. Right? Any questions? Questions? You guys all stayed awake today. That's pretty good with this crowd. Any questions, guys? Good? All right.
Well, what about water aerobics?
Fantastic. It gets your legs stronger, and with water aerobics too, you have resistance everywhere. My leg goes forward, resistance, leg backwards, resistance, sideways, circles, resistance. You're getting the whole leg stronger, even feet too, because your whole body has to move up and down. Phenomenal. Go for it.
Okay, another question.
Yes.
If you have had a knee replacement
Mhm.
and it starts to hurt,
Mhm.
is same exercise?
Yes. Just take it more slow. Again, exercise is great, but what is your tolerance level? So if I'm exercising and I raise my leg up here and it causes me to be uncomfortable, that's okay. But it makes me want to go, I guard and tighten, that's too much. Listen to your body. Any exercise you're going to do, it may be back, neck, foot, or feet. That point, if I'm moving my body and it hurts, you're in acute pain. If you've had surgery and it still hurts, say a month later, go see your doctor. There's nothing that's something that's not recovering fast enough. But you start range of motion naturally first, nice and slow. Fits my feet, nice and slow by myself. Over time, then add some more weight-bearing stress too. That's your question? But the guarding will, your body's telling you, hey, something's gonna tear or is unstable. Listen to your body. Yeah. But more than even 2 weeks, it's not getting better. That's a phone call. Yeah. Yes.
Suppose we have issues with our gait because there's a muscle up here that hurts when we walk, one leg or the other.
So you want to make sure we go through the exercise again too for the knee and also the lunges too. The lunges here, the lunges would tell you exactly what muscle it is. If I'm doing a lunge here where I'm in this position and it say hurts here, okay, what muscle is that? Part of my quad, but also part of my hip too. So for you so I would do the figure 4 stretch for that one here. And then over time, use your other hand, say it's your left leg and left hip, use your left hand to push that leg down slowly. Ligaments need time to stretch. This is not a movement here. This is not this type of stretch. It's a hold stretch and then slowly come down 10, 15 seconds, then relax, and 10 seconds again about 2-3 times. Give yourself time to stretch.
So you do that, say you want to go for a walk or something, and you have issues, then you do that.
I always look at my patients too, is make sure we stretch first and then do your activity. Stretch, then activity. Water aerobics, stretch first and then activity. I do pay attention once in a while.
That's my biggest problem, is knowing how to stretch.
Good. And this class will help kind of teach you that. Part of my talk too, as you guys, some people already know, is I put these on my YouTube. At the bottom of your paper is my YouTube channel. They'll be on there probably by 6 o'clock tonight. At that point, it has all that workshop link too. Also has a link to my previous workshops also I've done here for back pain, neck pain, hip pain, things like that. How to get off the floor, how to fall properly. I did that one, right? Yeah. Yes.
What about, I go up against the wall with the bar
Yeah.
and lean my elbows over and then I do my.
Go for it.
That's wrong.
Why?
Is that okay?
Yeah, why not? Yeah. You're a healthy person. Whatever you're doing is working. I'm going to have you do my next workout, my workshop, okay? Yes. Any other questions? Good? But again, exercise every day. Do something every day. If it hurts where you guard, okay, that's a problem. Let me figure out what that is. But if you exercise every day, you're going to know when there is a problem, so you don't have a major problem. All right, that makes sense? Get the heck out of here. I got to go back to work. All right, guys. Thanks for coming. Thank you. What's your name?
Maria.
Maria Tony. Nice to meet you.